All right, Toy, thank you for that update now. Well, certainly our prayers continue this morning for Buffalo Bills player Damar Hamlin. What happened to him Monday night, though, is generating a lot of questions about cardiac arrest, especially for a healthy person. Joining us this morning is cardiologist Tom Eagan from Brookwood Baptist Medical. He joins us by phone to hopefully offer some insight. Dr. Eagan, good to have you with us this morning. Thank you for joining us.
Good morning. I'm here this morning. Thanks for having me.
Thank you so much. And I want to make it clear at the outset, we're not speculating on Hamlin's condition right now or his situation. We're just speaking in general here. But first of all, I know this is going to seem like a rather pedestrian question, but just so everybody understands, what happens to the heart in cardiac arrest?
Well, cardiac arrest basically is sudden cardiac death, and it basically means the heart stops. There are a number of causes of cardiac arrest or sudden cardiac death. In this situation, we can only speculate, but in a young person, there's 4 or 5 things that go through your mind that could cause sudden cardiac death. One of the things in Damar Hamlin's situation could be what's called commotio cordis, which is where there's a disruption of the electrical activity from the hit to the chest, and then the heart stops.
And we don't know from anything from his family or that's been released any information on any sort of pre-existing condition. A lot of times that can't show up until something happens. But just in general, we have heard stories before of Little League players or even hockey players who, maybe hockey players taking a puck to the chest area where the heart is located. Explain what kind of trauma that can cause to the heart in terms of throwing off its rhythm that could lead to a cardiac arrest.
Right. So commotio cordis has been studied. There was a study published in 2007, about 200 patients. So it's not that common. It was first described in the 1800s from trauma and construction workers, and then more during the more modern era with sporting events. It was noted that young athletes would suddenly die after sustaining blunt trauma to the chest. And so these studies that were done and published have shown that in certain situations, right at the right timing of the cardiac cycle, if you're hit in the chest, on the left side of the chest, right over the heart, that can disrupt the normal electrical cardiac cycle and cause the heart to stop. This is most commonly seen in sports such as baseball, lacrosse, hockey, where there's balls or pucks hitting the chest just in the right time of the cardiac cycle and in the right portion of the chest. It's not seen that commonly in American football.
Right.
But that's how this works, and then that sends the heart into cardiac arrest. The heart stops, and unless you're resuscitated quickly, over 80% of these people will die.
Well, we certainly hope that is not the case here. And I was going to ask you as a follow-up, but normally he was resuscitated, we understand, at least twice. So, and that now they have him on a ventilator. They're hoping he can get a chance to breathe on his own. Normally this situation is, you mentioned that percentage, but the fact that, is that encouraging at all that, that we're hearing those reports?
Oh, absolutely. I mean, time is everything. What you worry about in this situation, I mean, certainly you got to get the heart started quickly, and an AED, an automated external defibrillator, is very important, and CPR at the time of the incident, the quicker you do it is very important. The reason being is a lot of times you can get the heart restarted, but when the heart's not pumping, there's no blood to the brain, and the brain will die very quickly. You may be able to resuscitate the patient, bring the heart back, but if the brain sustains too much time of no oxygen, it can die, and then you're left with brain death. So timing is everything. It is good news that he's still alive and apparently has responded, which is also a good sign. Typically when this happens, someone undergoes cardiac arrest, you sedate them, basically put them in a medical-induced coma, you lower their temperature to protect the brain, and you hope that they will recover with minimal damage.
Dr. E, we do want to point out he is reportedly still sedated, but we don't know all the specifics yet and won't. But let's talk just as we wrap up here. You mentioned AEDs. Obviously, it's very important to have those on hand where you can. How difficult or easy is it to train someone to use those? Because I mean, that really seems like a life-saving device that ought to be readily available everywhere.
Oh, absolutely. I mean, it's imperative. I mean, there's cities such as Seattle, Washington, where everyone is trained to use these devices. They have them on every corner. Birmingham, we're very fortunate. You have a number of medical centers in the Jefferson County area. The American Heart Association has done a very good job of training more and more lay people how to use these devices at public places, schools, churches, businesses, etc. And the more we can train individuals how to use these devices, because they're very smart, and that you don't really need to be a healthcare professional to be able to utilize them. They can do it automatically, and it doesn't take much time to be able to be trained, a few hours, and you can be trained on how to use these devices. And it's so important. As I said earlier, time is everything, and the quicker you can get to a patient, you can defibrillate them, the more likely they're going to survive.
No doubt. All right, well, again, we're praying for the best for Damar Hamlin. Dr. Tom Eagan, he is a cardiologist specialist there at Brookwood Baptist. We appreciate your time, sir. Thank you for that insight.
All right, take care. Thank you.
All right.